Good morning, everybody. I'm Allison Aubrey of NPR News, and I'm so pleased to be here. Thanks to the Aspen Institute for having us. I've got Dan Buettner here, who is the creator of the Blue Zones, and Dr. Dean Ornish, who is the father of lifestyle medicine. So for the last 25 years or so as a journalist, I've been telling other people's stories, mostly doctors, researchers, scientists, patients. But that changed last summer. I got a call from Northwestern University. Doctors there were starting a new longevity study, and I was asked, do you want to come cover the study? And then I was asked a question I had never been asked before. Do you want to be part of the study? That was a really interesting thing to ponder. I thought, do I really want to be poked and prodded and get so much information about what's going on into my body? So show of hands here, if you were offered the chance to be in a longevity study where they were going to be able to tell you whether your biological age was younger or older than your chronological age, which could be a little scary to know, would you do it? Yeah? Yes, yes. Everyone's curious. Well, I answered yes. So on a very cold, snowy day in November, I found myself on the elevator of the Northwestern Memorial Hospital to the 23rd floor, where I got off, and it felt a little bit more like a spa than a hospital. They quickly put me in a nice robe and some slippers, and I rolled up my sleeve, literally rolled up my sleeve for science. They took my blood. The first test they did is called a DNA analysis. It's a grim age test to test your biological age. Your biological age is how you're aging compared to your peers. Your chronological age, of course, is the date on your birth certificate. Throughout the day, I was poked and prodded in so many ways of so many tests. I wore a heart rate monitor, and then machine learning analyzed every beat of my heart. I went into a bod pod and had my body composition measured. So many things to learn. At the end of it all, I learned three things. One was pretty reassuring. Turns out that my biological age is younger than my chronological age, so that was a happy surprise. I learned something that was pretty predictable and a little bit depressing. I have a condition. It starts with the letter M. I'm sure a lot of women in the room. And my husband, who's seated right here, who's been living under the same roof with me for the past year. Menopause is the condition. And the third thing I learned was pretty surprising. One second, I'm going to take a quick sip of water. I have something called supraventricular tachycardia. And, you know what that means, right, Dr. Ornish? Yeah, so supraventricular tachycardia. What that means is in the 2 weeks that I wore the heart rate monitor, a couple of times at about 4 o'clock in the afternoon, the monitor found my heart going into a bit of tachycardia. My heart rate would go up to about 110, and I could feel it. It was just a little bit of a quiver. And it turns out that after years and years and years of being a journalist and being on deadline, that my body was tired of being in fight or flight. For 25 years, I've been running to the train and making the deadline and drinking a lot of coffee to meet the deadline for ATC or morning edition. And my body was telling me, you just can't do this way anymore. My body was calling out for more rest and digest. So as I pondered that, I thought, who can help me? Who knows how to put the body into rest and digest and to slow down biological aging further? And I happened to be joined by two of the people who have figured this out. And I love the way that they figured this out in different ways. So when I thought about the message, I've interviewed both Dan and Dean over the years, and when I thought about the messages that they're putting out into the world, I thought about a Venn diagram, all right? And I thought, okay, Dan stands for a plant diet, Dean stands for a plant diet. Dan stands for love, connection, community. Dean and Dan both talk about love, connection, and community. More movement, that's been a central message of both of theirs. More meditation, more reflection. The big difference on the outside of this Venn diagram is that Dean prescribes it as a doctor, and Dan, the explorer, has observed it happening organically in communities, blue zones around the world. So what I came up with is that Dan and Dean's messages don't even look like a Venn diagram anymore. They look so overlapping that I call it the Dan and Dean eclipse. So if you want to know or predict without being in a longevity study how long you think you're going to live, Dan has a little quiz for you.
Yes. So I'm a big, first of all, this is kind of fun, but I'm going to stand up because it's easier because I can see you. But Audrey went through a very sophisticated, expensive longevity test. I'm going to give you one that I'll bet you is almost as accurate and is free, and we're going to do it in about 2 minutes, all right? I'm going to ask you 8 questions, and your job is to raise your hand when the question pertains to you. And then the hard part, remember how many times you raised your hand. So you ready? Put my glasses on for this. They start easy, but then they get hard. Raise your hand if you sleep about 7 hours a night, most nights. Oh, there we go, well rusted. That's the number most associated with maximum life expectancy, by the way, 7 hours. Raise your hand if you move at least 30 minutes a day, most days. And it could be at a gym or it could just be walking or guarding. Wow, almost all of you. Raise your hand if you eat at least 5 servings of vegetables and or grains every day. At least 5 servings, whole grains. All right, a little fewer there. Raise your hand if you have not had unprotected sex with a stranger. I said not. Well, there they are. I'm going to stay up late with you guys today.
Oh my gosh.
These are real predictors of longevity, by the way. Raise your hand if you have at least 3 friends with the following criteria. Number 1, you can have a meaningful conversation with them. Number 2, you can call them on a bad day and they'll care. And number 3, you actually like them. Oh, There we go, almost 100%. Raise your hand if you think you're of average weight. You think you're about average weight. All right. Raise your hand if you've not smoked in the last 5 years. Not smoked. And we're in Colorado, I do mean tobacco. 5 years, okay. Finally, raise your hand if you think you have the capacity and the desire to live to be at least age 90. Capacity and the desire. Almost all of you. That's actually the biggest predictor. Paul Costas from the National Institutes on Aging found that people self-predict how long they're going to live much better than their doctors do, at least traditionally. Maybe there's new metrics. But this little algorithm I distilled from evidenced papers, created a longevity calculator called the True Vitality Test. These are all peer-reviewed. And it assumes an average age of 40, and looking around, I can see you guys are much younger than that. But it gives you within about a margin of error of 15% of how long somebody like you should live. And if you raise your hand at least twice, and your man life expectancy is 74, and if you're a woman it's 78, if you raise your hand at least 5 times, and you're a man life expectancy is 81, if you're a woman it's 85. And if you raise your hand at least 7 times, and your man life expectancy is 92, and if you're a woman, it's 96. Did anybody raise their hand all 8 times? Didn't he? Oh my God, would you guys stand up, please? Stand up, own it, it'll be good for you. I will not humiliate you too much. Stand up. Can we give these guys a huge Aspen Ideas round of applause? We have martinis for you in the back. You're dismissed. You don't need it. Anyway. So I'm a big believer if you can't measure it, you can't manage it. So now you have an idea. And we're going to, by the time this session's over, you're going to know how to live to your mid-90s.
I want to jump into something that's brand new. So if you know anything about the work of Dean Ornish, you know that he spent 16 years getting Medicare to cover a lifestyle intervention program. When he started the work looking at people who'd had heart attacks and had heart disease, the conventional thinking was that they needed to rest and that probably their best days were behind them. And Dean said, no, there's a way to get better. And he developed an evidence-based rubric of plant-based diet, love, connection, community, more movement, meditation, and reflection. So that was what, the year 2000 when you finally got Medicare to say, aha, this works as well as medicine, or
2010.
2010. Okay, so we're now almost 15 years later, and what has become increasingly clear in all of the evidence is what's good for the heart is also good for the brain. And what is everybody most worried about in life? Dementia, right? So Dr. Ornish has a brand new study, maybe you've seen it, it's gotten some media coverage over the last week or so, that looks at what happens when you take his lifestyle intervention and you apply it to people who've already been diagnosed with Alzheimer's. Why don't you describe the findings?
Thank you. Well, it's great to be here. What a beautiful day, right? I want to just begin, before I talk about this study, I want to acknowledge my wife, Ann, who has been a collaborator with me for the last 20 years, and 28 years, really, and as a co-author on the study, and Gary and Leonard and Laura Lauder, who helped make it possible. One of the things that Dan talked about so beautifully is how these simple, low-tech interventions can really make such a powerful difference in our health and our well-being and our longevity. And I think our unique contribution over the last 46 years of doing these studies is to use these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very low-tech and low-cost and often ancient interventions can be. So Ann and I wrote a book together called Undo It, and we put forth this unifying theory that why is it that these same lifestyle changes can affect so many of the most common and costly chronic diseases? And the answer is because they're not really so different. They all share the same underlying biological mechanisms, things like chronic inflammation, oxidative stress, changes in the microbiome, and telomeres, and gene expression, on and on and on. And these mechanisms, in turn, are directly influenced by what we eat, how we respond to stress, how much exercise we get, and how much love and social support we have, or to reduce it to its essence, to eat well, move more, stress less, and love more, as Dan was saying. And so the latest version of that was that, when we started doing the research on heart disease, people thought at the time that they talked about heart disease then the way they talk about Alzheimer's now, that at that time it was thought that once you had heart disease, the best you could hope to do was to slow down the rate at which you got worse. You get worse, but just maybe a little more slowly. We found back then that when you made big changes in a lot of things at the same time, then instead of getting worse and worse, people could often get better and better. And the more they changed, the more they improved. And we published our findings in all the major peer-reviewed medical journals. And over time, I thought that when we published those findings, that would change medical practice. And to some degree it did, but I realized that it's not enough to have good science, you have to have reimbursement. And so we were really grateful that after many years of review, CMS created a new benefit category to cover our program for reversing heart disease. And so we have tens of thousands of people who've been through that. And if anything good came out of COVID, it was learning that we could do it as well by Zoom. So now, rather than having to go to a hospital or clinic, you can do it out of the comfort of your own home, which makes it really easy. So what's good for your heart is good for your brain because they share the same biological mechanisms. So I wondered what would happen if we used these same lifestyle changes in people who had early Alzheimer's disease. And what we found is that in a randomized controlled trial, over just 20 weeks, that the majority of people who made these lifestyle changes showed improvement in cognition and function compared to the control group that worsened in all four measures. We use the same measures of cognitive function that are used in the FDA drug trials. And so there are only 3 drugs that have been approved in the last 20 years at a cost of billions and billions of dollars. And one of them was taken off the market recently. The other 2 just slow down the rate at which you get worse. They pull amyloid out of your brain. And as a result, about 20% of the people get bleeding into your brain and swelling of your brain, little side effects like that. But they only slow the rate of getting worse, in some cases really by an imperceptible amount. But there's such a dearth of hope. When you get diagnosed with Alzheimer's, they take all your hope away. They say, I'm sorry, Mr. Jones or Ms. Smith, you've got Alzheimer's. It's only going to get worse. We can maybe slow it down a little bit, get your affairs in order. If there's anything you want to do it now because you don't have much time. And when you lose your memories, you lose everything. It's a devastating diagnosis. So to be able to say that not everybody gets better when you make these lifestyle changes, but a lot of people did, and one of the major measures, 73% of the people stopped or reversed the progression of their Alzheimer's, whereas 68% of the control group patients got worse during that time. So we can now say many people, and to the degree you make these changes, you get better. And even looking at the amyloid, we found the same thing that is pulling the amyloid out of the brain. But it's not just the only mechanism. These other lifestyle mechanisms improve as well, and that's why you often can see improvement. And when you take someone's hope away, I was suicidally depressed when I was in college because I had no hope. I felt like I was stupid and, nothing mattered. I could take all the hope out of life. But I learned that I could imbue my life with hope and meaning by doing acts of service. And so I learned how powerful hope is, or the lack of it. And so now that we can give millions of people new hope and new choices in the area that matters most, is it okay with you if I can just show this little clip?
Absolutely. What I was wondering is, how do you can do these assessed, validated assumption tests to see is somebody improving or not, but how does that translate functionally? If you've been around anyone with Alzheimer's, you know how discouraging and difficult and frustrating life can be. What changes do you see as you're measuring these changes in the brain? Can people start to do things they hadn't been able to do before?
Yeah, that's the thing that's so amazing, because you can say, well, it's statistically significant, how clinically significant it is, but it can really make major changes and really, give people new hope and new choices that, so much of this can be self-fulfilling. If you tell somebody you're only going to get worse, it's such a devastating diagnosis. It's almost like your brain shuts down as an adaptive response and in many ways becomes self-fulfilling. But hope can be self-fulfilling too. If you say, if you're willing to make these changes, there's a good chance you can get better. That can motivate people to do that. So I'm going to show you just a 3-minute clip of one of the women. It turns out twice as many women as men get Alzheimer's, and yet the drugs don't work as well in women.
11% improvement is what I read.
Yeah, it's really small. And it doesn't work in people who have both of the Alzheimer's genes. I have one of the genes, but if you have both of them, it's really much more likely that you're going to get it. And this woman has both of the genes, and yet she still has an amazing story. And we have so many of these patients who had their own versions of this story. But I just want to, it makes it real. Stories people like to dismiss as being anecdotal, but in the context of having the statistics, I think stories can be powerful. So if you could play that clip now, please. What have you noticed in terms of your cognitive function or any other things that you've been looking at?
Well, I'm starting to read more. I had lost that ability. I'd love to read. I'd be the kind of person who would pick up a book, and I don't care how big it was, I would not put it down. I'd not go to sleep at night because I had to finish that book. So I'm not reading to that degree, but I am starting to read, and I've chosen to start with a smaller book so that I can feel that accomplishment a little bit earlier for me.
And you stopped reading because why?
I could not retain the information. I would forget who the characters were. I'd forget what order things were going in, and it just got to be, one, humiliating for me, but it just became too difficult, so I thought, I'm just not going to do that. I gave up the cooking for a long time and doing those kind of things, and so that has started to come back.
How long did it take before you started to notice improvements?
Oh, that's a good question. I'd say, in the scheme of things, relatively quick.
Yes.
I mean, given I'd been on Aricept for so long, I didn't see any changes with the Aricept.
Right.
So this was...
We'd say around week 12 would
Okay.
be a good estimate.
Yeah, probably.
Yeah. And you mentioned before also you're able to do your taxes.
Yes.
Tell me about that.
Oh, yeah. In fact, so we've got several small businesses, property management, and I used to do all the books for that, and then obviously didn't. And then this year, I said, would you like some help? And he says, yeah, here's this stack of stuff that we need to go through. So I organized it all, put it all into piles with pieces of paper on headers so I could hand it to him, but then I took it a step farther, and unbeknownst to him, I created spreadsheets. They're all color coordinated. It has a face sheet on it that says, this is what we earned, this is what we spent, here's our net, this is our whatever's all written out, and said, here you go, it's all done.
It was astonishing.
Why?
Well, for one, I didn't have that expectation. I had the expectation of, just go assemble these in some sort of an order so then I can go back and take care of it. But when she came back to me, they were not only all categorized in a proper order, or beneficial order, more importantly, they were all done correctly.
Yeah.
And for me and for Tammy, it was like absolute jubilation.
It
It was exciting. Do you realize what you just accomplished was such a remarkable...
Down to using the calculator, which I hadn't, and he says, well, I'm going to check your math, even with the calculator. I said, calculator's not going to lie, but go ahead, and his numbers matched mine.
Wow.
I was like, yay.
No,
Yeah.
my numbers missed yours.
That's true, that's true.
Now, was that something that you couldn't have done a year ago?
Oh, yeah, for sure. Yeah, I don't think it's been 4 or 5 years probably that I've really gotten involved to that degree.
What might have happened?
Well, I would, one, get really frustrated with myself, and then I'd get the paperwork all mixed up, and I'd put them in the wrong pile, or I wouldn't add it up properly, and it became so confusing. I just hand him this jumble of papers, essentially, and say, I did the best I could, good luck.
So how does it feel to be able to do things that you didn't think you'd be able to do before? How does that make you feel about yourself?
I think that deep sense of identity is returning. It's given me like a new lease on life, and yet it's a familiarity and something that I always prided myself in. And so it's like, yes, I'm coming back. Feels really good.
You're coming back like
I was prior to the disease being diagnosed.
Yeah, one of the other study participants said, I feel like I'm me again. Does that sound familiar?
Absolutely, that's a great way of putting it. Yeah, an older but better version of me. Yeah, I really feel that way.
She had been diagnosed with Alzheimer's disease. She was diagnosed with Alzheimer's disease.
Right.
The intervention was 20 weeks, and that's the result.
Yeah, and several people. You know, one of the biggest obstacles I found in these many decades of doing research on lifestyle, and I'm sure you found this to be true too, Dan, is that people think, oh, it's got to be a new drug, a new laser, a new device, a surgical procedure, something really high-tech and expensive to be powerful. And people often have a hard time believing that these simple lifestyle changes can make such a powerful difference, and how dynamic these mechanisms are, and how quickly you can get better or worse, sometimes within hours and certainly within weeks and months when people make these changes. Like in the case of heart disease, your chest pain goes away in a few weeks in most cases. So it really redefines the reason for making lifestyle changes from fear of dying to joy of living. You know, if you tell somebody, when someone's had a heart attack, they'll do pretty much anything you ask them to do for like a month or two, and then they stop because they say they don't want to think about something bad will happen to them. But if their chest pain goes away when they make these lifestyle changes, and they go, oh, I can, you know, make love with my spouse and play with my kids and go back to work and do all the things that make life fun. Yeah, I like eating cheeseburgers, but not that much. You know, I like having these, what I gain is so much more than what I give up, it makes it sustainable.
With the advance of diagnostics, it's now possible to find out much earlier. Do you have dementia? Are you at risk of Alzheimer's? What's your risk of developing Alzheimer's?
Right.
I think people have been very scared of that because why find out that gap between the diagnostics and the interventions?
Yeah, they say, like, why would I want to know? I mean, with the new AI technologies, I'm sure you can talk about that. You can, like 10 years before it becomes clinically apparent, people can learn that they're likely to get Alzheimer's. They say, why would I want to know if I'm likely to get something that I can't do anything about? But if we show that we can, in many cases, reverse the progression of early-stage Alzheimer's, then it's probably going to make it even more powerful to help prevent it. And if it's anything like heart disease, which I think it is, the earlier you intervene, the more powerful it's likely to be, and the less you likely have to change your lifestyle.
Dan, as you watched this, someone with Alzheimer's say, I'm better now, I feel hope. What went through your mind?
And also, if you could talk about in the blue zones, that they also have a lot lower risk of Alzheimer's and dementia.
Yeah. Well, most of our healthcare, the money we spend on healthcare, which is about $4.4 trillion a year, we aim at the complete wrong target. 85% of it is aimed, more than 85% of it is aimed at trying to clean up the mess after it's happened. Whether it's Alzheimer's, at least 50% of it's avoidable. And I think Dean's work underscores the avoidability of it. Estimates go as high as 80% of it's avoidable. Yet we spend billions of dollars on these treatments and pharmaceuticals and things that are good business plans, but they actually don't work very well. It's the same with heart disease. It's the same with type 2 diabetes. We have from Blue Zones and from Dean, that's why we're such a good pair, because I've looked back and found actual populations who are making it into their mid-90s or hundreds occasionally that have almost completely avoided type 2 diabetes, almost completely avoided cardiovascular disease. One place we found, Icaria, Greece, We only, on an island of 10,000 people, we found only 3 incidences of dementia. And this is a genetically heterogeneous population. In other words, they're a melting pot. They don't have anything genetic. So we know exactly the cluster of factors that we need to put in place to deliver a near chronic disease-free population. And we don't spend the money on it. And Dean now has proved it with his research. I take a slightly different route. I'm actually not a big fan of the word lifestyle because, like well-being, you can't really measure. It's one of these amorphous things, or it's like moderation, whatever the hell that means. I do like the things we can measure, and we can measure BMI. We can measure the blood sugar in our blood. We can measure our blood pressure at a population level. We can measure life satisfaction and how these different interventions that Dean and I both try to put into place actually lower your chance of disease and increase your chances of happiness.
I want to talk a little bit about the big divide between knowing and doing, because in some ways, I think what you're saying here, plant-based diets are important, love and connection and community are important, movement is important, meditation is important. When we say these things, we're not telling anybody anything that they haven't heard for a long time. You can talk to kindergartners, and they will tell you that carrots and hummus are better than hamburger and fries, right? So let's talk about this divide between the knowing and the doing, and the way that our society reinforces the wrong decisions. It's much easier to eat a diet that is hamburgers and fries than it is to eat vegan. It's much easier to sit and scroll on social media than it is to engage and actually take the time and effort to make new friends and build community. What do you observe in the Blue Zones, Dan, that helps to kind of erase that divide between the knowing and the doing? And then how does the program help do it as well for you, Dean?
So we are genetically programmed to crave fat, sugar, salt, and take rest whenever we can. The human species has been around for about 25,000 generations. 99.8% of them, we've lived in an environment of scarcity and hardship. So having genes that crave that make us crave these things, they're very useful in those environments. Unfortunately, we live in an environment of abundance and ease right now. We're no more than 5 steps away from chips and sodas and rich foods. The amount of time we spend in our cars doubled in the past 30 years. We use mechanized conveniences to do most of our work. We're constantly comfortable. We're following our genetic impulses on that. The problem is that is making us sick. It's the affluence and it's the overabundance that's making us sick, added to our genetic inclination to want them. We have tried for at least 75 years to promote the idea of exercise, and it has been an unmitigated public health failure. I asked that question, raise your hand if you get 30 minutes of physical activity a day. Only 20% of Americans get anywhere near that. The other 80% don't even get 20 minutes a day. Doesn't work. People know we should be eating, we all know what eating healthy is, but we don't. 75% of us are overweight or obese. That's not our fault. In Blue Zones, these populations, and I found 5 of them, and we confirmed them demographically, they're making it into their 90s, largely without chronic disease. They're no better than the rest of us. They don't have more discipline or more individual responsibility than we are. They're not better people than we are. They don't have better health care plans. They don't have a customized food as medicine program. They just live their lives. The reason they're living longer is their environment is such that every time they go to work or a friend's house or out to eat, it occasions a walk. They don't have mechanized conveniences doing their work. The cheapest, most accessible, and most delicious, by the way, food, the recipes, is peasant food. Beans and whole grains and tubers. If you're eating a cup of beans a day, it's worth about 4x years of life expectancy. The option to implode into your house and get onto some screen doesn't exist, because every time you walk out, you're going to bump into your friends. You're expected to show up to church. You're expected to show up to village festivals. We see very clearly the cluster of factors that is manifestly delivering populations who at our age, middle age, live 10 years more. And they're 10 good years. But our healthcare system doesn't pay any attention, very little, fraction of a percent. We spend it on drugs and treatments and go see your doctor some more.
But we're not going back in time. We're not going to a place where, Ikaria, Sardinia, Okinawa, these are isolated, rugged places, small communities of people. They're cut off from the modern world that we all live in. And we're not going back to that time. So what is it that we can borrow and infuse or weave into our lifestyle here and our sort of 24/7 go-go lifestyle? How can we borrow and learn and weave it in to the intervention that you have developed?
Sure. Well, just to build on what Dan said so beautifully, information's important, but it's not sufficient. It's like you say, it's not like I go to, Mr. Jones, I want you to quit smoking. Did you know it's bad for you? Gee, I didn't know that. I'll quit today. It's like everybody knows it. It's on every pack of cigarettes. So in doing these studies, I got to spend a lot of time with the same groups of patients, sometimes over years. And, pardon me. And I'd ask them, why do you smoke? Or why do you overeat or drink too much or work too hard or abuse substances? These behaviors seem so maladaptive to me. And they'd say, they're not maladaptive. You don't get it. They're very adaptive. They help us deal with our pain, our loneliness, our depression. The real epidemic the pandemic really, isn't just heart disease or Alzheimer's or diabetes. It's loneliness and depression and isolation. With the breakdown of the social networks that used to give people a sense of love and connection and community. 50 years ago when I was growing up, we had an extended family we saw regularly. We had a neighborhood with 2 or 3 generations of people that grew up together. We had a job that felt secure, that people would be at 10 years or more and got to know their coworkers. They'd have a church or a mosque or a club or synagogue or something they went to regularly. And many people today don't have any of those things. And people say, well, that's just modern life. But, I wrote a book about this back in 1998, which had hundreds of studies, and now tens of thousands of studies. Vivek Murthy, a good friend who's the Surgeon General, has made this one of the centerpieces of his tenure, is that when people who are lonely and depressed and isolated are 3 to 10 times more likely to get sick and die prematurely than those who have a sense of love and connection and community, which is such a powerful thing in the blue zones. You're more likely, people say things like, I've got 20 friends in this pack of cigarettes and they're always there for me and nobody else is. You're going to take away my 20 friends? What are you going to give me? Or food fills the void, or fat coats my nerves and numbs the pain, or opioids numb the pain. We have this huge opioid epidemic. Or alcohol numbs the pain. People are drinking more than ever. Or video games distract me from my pain. And so I've learned it's not enough to focus on the behavior, but really what underlies the behavior. And so part of our group, when people think of our work, they generally think about diet. And clearly diet's important. But the support groups, the love more, eat well, move more, stress less, love more. What is that love more part? What does that mean? Is that the clothing optional part of your program? No. It's about creating safe places. When you grow up in an extended family, they know you. They don't just know your Facebook profile. In fact, when Ann and I wrote this Undo It book, one of the studies we cited in there was that the more time you spend on Facebook, the more depressed you are. Well, why is that? Because it's not an authentic intimacy. It looks like everybody has this perfect life but you, because nobody talks about their darkness and their demons on Facebook usually. Whereas when you grow up in an extended family, they know you. They know that time you got busted, or you got hooked on whatever, or you broke that window or whatever. And you know that they know, and they know that you know that they know, and they're still there for you. And it's like in James Cameron's films like Avatar, I see you, which is really an African proverb. I see all of you, not just your good stuff, and I'm still here for you. And there's something really primal about that. So the support groups in our program are not just to help people stay on the diet. It's to create a safe place where people can let down their emotional defenses and talk openly and authentically about what's really going on in their lives. Somebody can say, I may look like the perfect dad, but my kid's on opioid. And somebody says, I've got an opioid problem too, or my kid has this problem. And it's not about fixing the problems. It's just about creating a safe place where people can talk about that. And the work that I understand that you do in the Blue Zones is that's part of one of the most powerful factors of these cultures, is that they really see you and yet they're still there for you.
Go ahead.
I'd like to answer that. How do you actually make it work in the United States? First of all, is forget the myth that you can get people to change their behavior. If you look at the recidivism curve for diets, exercise program, taking supplements, people stay on these things for months, not years. And one thing I'll tell you for sure, there's nothing you can do this today or this month or this year that will determine whether or not you live another year in 2070 or 2060, whenever. The only thing that works when it comes to longevity are things you're going to do almost daily for a long time. And trying to muster the discipline and the presence of mind doesn't work. It's a great business model. It's a great business model to get you excited about a new diet on New Year's Eve. I'm going to make a resolution this year, and they all fail by January 19th, or 80% of them. So we've been very successful at going into cities, 72 to this day. My daytime job is doing this. I work with a company called Blue Zones now, and we're supported by local governments and funded privately. And we don't go into a city unless the mayor, the city manager, the superintendent of schools, the head of the Chamber of Commerce, the big CEO, they all say, we get it. We will pledge to work with you. And we don't try to get people in that city, 1 million people like Fort Worth, to change their minds, because you can't get them to agree on anything, beginning with politics. So all we do is we reshape their environment, engineering their unconscious choices so they're slightly better all day long. What do I mean by that? We work with city council. We have policy bundles for built environment, which is sort of how you design your streets and sidewalks, food, favoring healthy food over junk food and junk food marketing, and smoking. And there are gold standard policies that have worked elsewhere, evidence-based, and we make city council and the mayor pledge to us to spend 4 hours to go through every policy and evaluate for effectiveness and feasibility. Can I pass this policy here that will get people out from behind their steering wheel on their feet? That's what works. Or that gets them eating fewer French fries, fried chicken and hamburgers, and eating more beans and grains. There are policies where you can nudge people in that direction. Then we go to every single restaurant, grocery store, workplace, and school, and we have a certification program that if they shape the environment that nudges people into moving more, eating less and better, socializing more, and knowing and living their purpose, very Dean Ornish, and then we get 15% of the adult population. Every single city we've gone in, Gallup measures it, by the way, third party, BMI goes down. What happens when BMI goes down by 1% in a population of 1 million? That staves off about 19,000 incidences of cardiovascular disease. That's what works. We have to quit the folly of thinking we're going to convince Americans to eat the best way, because they can't agree on anything, or think they're automatically going to start moving more, and set Americans up for success. And our food environment and our built environment isn't doing that right now.
I just want to build on what Dan said. Dan has been focusing on the macro. We're focusing more on individuals. And we have been able to show that 93% of the people who go through our program, which is a 72-hour program that Medicare has been covering, and by the way, we're really grateful to Medicare. It took 16 years, but they created this new benefit category to cover our program, and we were training hospitals and clinics and physician groups. But then, if anything good came out of COVID 3.5 years ago, was learning that we could do it as well by Zoom as doing it in person. And that was really a game changer, because before you had to live near a hospital or clinic we've trained, now you can do it in the comfort of your own home. And so we're finding that it's a 72-hour program. So it's an hour of exercise, an hour of meditation and yoga. Who would have thought Medicare would be paying for that? An hour of a support group, and an hour of a lecture. We do it twice a week, 4 hours at a time for 9 weeks, for 72 hours. 93% of the people who start that finish all 72 hours. 85% of them are still following it a year later. And the reason is that, first of all, you feel so much better so quickly. The paradox is sometimes it's actually easier to make big changes than small ones, because when you make big changes, you feel so much better so quickly, it reframes the reason for making these changes from fear of dying to joy of living. But also, the support group is really key. When people connect with each other so deeply, and I didn't think it would work as well by Zoom, but I was wrong, it worked just as well. After their 72 hours, their 9 weeks, they continue to meet on their own 85% of the time. And that support is, you're much more likely to make lifestyle choices that are life-enhancing than ones that are self-destructive when you have that support. And so we've been talking with Medicare about, will they broaden the coverage to include Alzheimer's disease? They're going to spend $5 billion this year on that one drug that doesn't really do much. So I'm hoping that they will. If you're interested in more about our work, whether it's for heart disease or Alzheimer's or anything, just go to ornish.com. But the beautiful thing is that when we can focus not on the behaviors or just tell people, oh, do this and don't do that, even more than being healthy, people want to feel free and in control, and that goes back to the first dietary intervention, when God said don't eat the apple, and that didn't go so well, and that was God talking, It's to say, look, we can support you in these choices if this is what you choose to do. And when we can not only just focus on the behavior and give them the information, but on these deeper issues of loneliness and isolation and help people really connect at a deep level, then they're able to make these changes in a sustainable way.
I think one of the most interesting things about the topic of longevity is that when you start talking about it, even look at the headline of this session this morning. It's called Unlocking the Secrets of Longevity. And I think what's so interesting about this is that, are these really secrets? Are these secrets that eating well and exercising and having community and friends and time for reflection, that this is good for our health and helps us live longer? It seems to me like a lot of the secrets of longevity are hidden in plain sight. They're right here. Like we all intuitively, we know these things. We don't want to be the salmon swimming upstream to live in a healthy way. We want to change society so that it's the easy thing to do, like you've seen in the blue zones. I want to talk about one thing that doesn't get much attention, but I found stunning in the longevity literature. There was a study published in PNAS in 2019 on Optimism, a large cohort study looking at sort of set points of people. And it turns out that optimists live longer, 15% longer. I started thinking about that and thinking about what you were saying about what's at the root of, addiction, smoking, alcohol, eating too much, is this an isolation and loneliness and this sense of despondency. And so what is optimism? Optimism is the opposite of that. It's the sense that you can solve problems. It's the agency that you can do the things that are good for you. And once you're doing the things that are good for you, guess what? That makes you want to do the good things for the people around you, your community, your children. And when your children are launched, for society,
Absolutely.
To be more civic-minded, even. So I'm wondering if do you agree that optimism is an important part of this longevity equation?
Yeah, it's optimism and meaning. I put them together. They go hand in hand. And as I mentioned, I could take all the meaning out of life when I was 19 and almost committed suicide, but I learned that I could imbue my life with meaning, in my case, by doing acts of service. So it's the most selfish thing I can do to help somebody else. So in working with patients, I'll say, why are you here? Well, I want to live longer. Okay, why do you want to live longer? My wife, Ann, is really good at asking people about that. And they'll say, gosh, no one's ever asked me that before. Doesn't everyone want to live longer? I said, no, people are really depressed. They're just trying to get through the day, They say, well, let me think about that. Oh, I want to watch my kids grow up. I want to dance at their wedding. I want to, whatever it is. And if you can get somebody connected with that, and that gives them that sense of optimism, because yes, maybe I can do those things, that's a very powerful thing. Even Viktor Frankl wrote about that years ago. And, concentration camp survivors, the ones who survived weren't necessarily the strongest or the healthiest, the ones who had that sense of optimism and meaning and purpose. Like, I need to survive so that I can bear witness or see my family again or whatever it happens to be. Don't you find that in the blue zones as well?
Is optimism as important as beans?
No, beans are more important. Beans, we can
Dan
measure
will always
beans.
defend beans.
Well, you say how you bean, it's the same thing.
Well, the reason beans is they're cheap, they're shelf stable, you can make them taste delicious, and they're full of the fiber, which Americans aren't getting. But nobody markets beans. They're not cool, so people don't know about them, and it's one of those things hidden in plain sight. The problem with optimism, I think it's more genetically driven. So the heritability of optimism is about twice that of longevity. Only about 20% of how long you're going to live is driven by your genes. Optimism, a lot of people either have it or you don't. There are these sort of positive psychology interventions, but none of them seem to last more than 6 months, or they're not measured more than 6 months. But I do think the point Dean made is an important one. People who have a sense of purpose. And what I mean by that is they know what they're good at, they know what they're passionate about, they know how they can help, and they have an outlet of it. In all these blue zones, there's actually vocabulary for purpose. And it's not just like being good at model airplanes and knitting. There's always an altruistic outlet for it. And that's actually been measured. Robert Buettner, who director of the first National Institutes on Aging, looked at people's writing, a cohort of people, and followed them for 10 years, and found that people who had a sense of purpose we're living about 8 years longer than people who don't. And I know of no such, well, maybe you know of one of optimism, but the problem is, how do you get optimism? We know how to find our purpose, and we know how to put our purpose to work. And by the way, volunteering, everybody rolls their eye, volunteer. People volunteer, especially at our age, and this has been measured by someone named Linda Fried. As simple as reading to kids in an elementary school, healthcare costs go down, BMI goes down, and instances of cardiovascular disease go down. It's one of the best ways to find purpose and to live longer.
I think purpose is pretty well worked out when you're early in your career, when you're having children, you're a mom, you're a journalist, your days are full, your purpose is those things. I think a lot of us in this room are at a time when we might be looking at like the second adulthood, or what I call the third turn. I've been reading the work lately of Mary Catherine Bateson, who's a late anthropologist, and she wrote that, speaking of Erickson's 8 stages of development, that when you get to about this age where your kids are almost launched and you don't have to be laser focused on the paycheck so much, you get space and time to say, what am I? Who am I? What is my identity? And it's a little bit of a crisis. If you have any teenagers in your house and you're watching them go through puberty, you'll think back to Erickson's stage of development in puberty, where you're supposed to struggle to figure out what your identity is, right? And if you've been around teenagers, that's hard to watch that struggle, right? You watch the hormones go up and down, and the mood and the anger, and we have a 13-year-old at home right now, and it's tough sometimes. Sometimes you just have to be the sponge absorbing all of it. But guess what? We go through it again at about this stage of life in the 50s, where, kids are on their way, careers under control, and you're thinking to yourself, what's next? And so if you're going through a time where you're struggling, thinking, I'm not sure what's next, and it's feeling a little bit unsettled, I think that's part of the process. Do you agree?
I do. And, my spiritual teacher used to say, he would like to make puns. He said, we're born fine, and then we define ourselves, and we get stuck in all these definitions of who we think we are. And I think that, if you want to take it to a more spiritual level, I think anything that brings us together is healing. Even the word heal comes from the root to make whole. Yoga is from the Sanskrit, to yoke, to unite, to bring together. These are really old ideas. And so, the idea of, meditation, for example, the ancient swamis and rabbis and priests and monks and nuns didn't develop these techniques to lower their blood pressure or their cholesterol or their, perform better in board meetings or in sports. It can do all those things, but they're really powerful tools for quieting down our mind and body to experience more of an inner sense of peace and joy and well-being. And to say, okay, so instead of saying, gosh, if only I had more whatever, then I'd be happy, to say, my natural state is to be happy. The meditation doesn't bring you a sense of peace and well-being. It's already there. It's like, it changes the question from how can I get what I think I need to be happy and really define my life, to how can I stop disturbing what's already there. My teacher used to make puns. He said, people say, what are you, a Hindu? He'd say, no, I'm an undo. That's why we called our book Undo It. So then the question says, what am I doing to disturb my own inner peace? That I can do something about, not to blame, but to empower myself. And so what I'm learning is that if you can take that even deeper, that it gives you this dual vision, this double vision, that on one level we're separate, you're you and I, me. On another level, we're already connected. Some people do that through psychedelics, some people do it through meditation. But whatever path you get there, it gives you that kind of like the light in a movie projector. The light goes through the film and projects all these names and forms and dramas on the screen, which you can get lost in if you don't forget that there's also that light behind it. And so for me, redefining ourselves, really, we give all degrees of freedom to the degree we can come from that non-dual place, as well as not get stuck in the ways that we define ourselves.
We have time for maybe 1 or 2 questions. Oh, I knew there'd be a lot. Okay, right here in the front. Yeah.
What do you think about
There's a microphone coming. Yeah.
We're living in an age now where cannabis is readily available. And I remember when I did studies with the scientists in Harvard, I saw how the hippocampus shrank. How will this affect memory and Alzheimer's?
I'm sorry, what were we just talking about?
Cannabis.
Sorry. I think those studies are interesting, but I think the jury is still out. We know alcohol certainly can cause your brain to shrink. Whether cannabis does in moderation, I think, is really an open question. I don't know, Dan, what are your thoughts?
Yeah, I think alcohol is far more dangerous at a population level than cannabis is. Plus, it's plant-based.
Right back here.
Alcohol is plant-based too, actually.
You know, so many of us are leaders in our own institutions or involved in healthcare and have many employees. We discussed a lot from a macro level and an individual level, but as an employer, what opportunities do we have to help our staff, to help our employees, to create an environment to improve longevity, to improve lifespan, to improve health span? What can we adapt from your learnings into environments to create the impetus and the starting point for those that we care about and are working with us?
Well, let me just say something then with Dan too. One is create a sense of meaning. I think that's the most important thing. In a large corporation, it's so easy to feel like, you know, what you do doesn't matter. Number two is that most large corporations are self-insured. So when you save money, it goes right to your bottom line. And we've already done a couple of studies. One with Mutual of Omaha, we cut costs by, but they save $30,000 a patient in the first year. Highmark Blue Cross Blue Shield cut their costs in half in the first year. But again, I think I'm going to put this over to Dan to make the healthy choice, the easy choice in a corporation. What are your thoughts about that?
So Gallup interviewed 2 million employees and found that the number one determinant of whether or not you like your job is not how much money you make, not do you like your manager, do you have a best friend at work? And one of the strategies we use in our Blue Zone companies is we help make sure we take the time for employees to know each other on a human level, and then we just challenge them to walk and eat together, form bonds. So that's very cheap, very effective. Number 2 is going through your food environment and looking at what's in the vending machine, what your policy is during conferences and meetings, what kind of food you let fly, what happens in the break room. And then if most companies have the power to say, we're only letting this kind of food. So taking the sodas, the candy bars, and the chips out of the work environment, you'll see BMI go down. And the third thing is incent people to walk or take public transportation to work. Why? We know that people who take the bus to work have about 19% lower rates of cardiovascular disease. We can measure that. So in my company, if you drive, you're on your own. If you take the bus, we'll reimburse you. And if you ride your bike, we actually give you $5 a day for riding your bike to work or walking to work. So those are things that work.
One final question over here. Yeah.
You guys are staying after school, by the way.
Yeah.
All of your suggestions are wonderful. They make sense. But the real question is, how do you start? Do you buy your book and read what they say, or do you recommend some type of residential program where you can go for a few days or a few weeks?
Well, we have both. And, you know, we have a book. We have a lot of books. We have residential programs. We're mostly focusing on doing this by Zoom so people can do it anywhere. That really helps reduce health disparities and health inequities. Like even when people live near a hospital or clinic we train, maybe they couldn't afford to take off work, or they couldn't get childcare, or they didn't want to get exposed to COVID. So now you can do it from home. But find the way that's right for you. You know, for some people, small gradual changes are easy. From other people, immersion, making big changes all at once is actually easier, because if you have heart disease, your angina goes away, or in a few weeks your cognitive function begins to improve. And so for many people, those choices become clear, and for many, they're worth making. Again, if you're interested, just go to ornish.com. There's a lot more information there.
I have 3 things very quickly. First of all, learn how to cook plant-based at home. As soon as you find a half a dozen recipes you like better than dead animals or fast food, my job is done. Number 2 is take the time to do the internal inventory, what you like, what you're good at, and an outlet for it. And number 3, curate your immediate social circle. Friends are long-term adventures. They have a measurable impact on what you eat, how much you move, what other things you put in your mouth, and how you feel. So instead of a New Year's resolution of, I'm going to get on a diet this year, make it a point to add a couple new friends to your immediate social circles whose idea of recreation is playing pickleball, for example, or golfing or walking, who care about you on a bad day, or who... it's not a bad day to have a bad idea to have a Dean Ornish or a Dan Buettner in your immediate social circle, because we're going to show you where and how to eat delicious plant-based food. And I also have a documentary on Netflix called Live to 100. And a bunch
It's great,
of
by the way.
And
Just won 3 Emmys.
yay.
And so the time we spend with our friends and family is not the luxury that you do after you've done the important stuff. It is the important stuff.
Well, with that, I am very pleased to say that I am with so many like-minded people this morning. Thank you so much for your time, and thank you to the Aspen Institute.